first of all, let's start here. The hospital doesn't solely rely on federal funding, but it is a major part of it. And right now, the government is planning to terminate the hospital's Medicare contract on February 23rd. Experts say that's important because a lot of children who are chronically ill receive reimbursement through Medicare. And this is a stunning fall from grace for a hospital whose patients had come to expect the highest quality of care. It wasn't that long ago that Johns Hopkins All Children's Hospital was a gold standard in the medical industry. But a recent federal report is casting a long shadow over its future.
The hospital could be cut off from all federal funding, and that's a big deal.
Last month, investigators conducted a week-long review of the hospital, and on Friday, All Children's interim CEO received this letter, notifying him that inspectors found problems that represent immediate jeopardy to patient health and safety. It's a rare finding that under federal guidelines is considered a crisis.
It's a very important component of this community, both to clinical care and research, and maybe this is a wake-up call for the big boys.
He's referring to Johns Hopkins. In 2016, All Children's then CEO made this announcement when the university rebranded the hospital.
We're able to provide services like never before.
But last year, a Tampa Bay Times investigation revealed that nearly 1 in 10 children who underwent heart surgery died in 2017. The mortality rate had become the highest in Florida. Federal investigators were sent in and found major issues like insufficient infection control, poor communication, and potentially questionable qualifications among staff. USF Health Associate Vice President Dr. Jay Wolfson is an expert in this field and believes the problems started when Hopkins took over in 2011.
They lost control over what was going on down here. And because they were almost in a free fall, things got out of control.
Hospital executives now have until February 10th to come up with a detailed plan, or they will lose federal funding. Wolfson says this should be a long recovery with a renewed focus on the community.
This may be a great opportunity for Johns Hopkins to reach out more aggressively to some of the entities and individuals that it pushed away beginning in 2011 to create a truly collaborated, community-based system for providing the highest quality care for children.
And as a result of that Times investigation, last month, 5 hospital executives resigned, including the former CEO and the former director of the hospital's Heart Institute. In a statement, a hospital spokesperson said, in part, quote, "We are confident that the work we are doing to meet the highest standards of care will satisfy any concerns of the federal government, our patients, or our community."